Welcome to Totally Woman Podcast. Totally Woman is a bi-weekly podcast that uncovers essential health knowledge and highlights inspiring journeys that transforms women's lives. I'm your host, Rosemarie Crosdale, a licensed adult gerontology nurse practitioner, and this season, we want to hear from you. Find us on Instagram at Totally Woman Pod to join our conversation. While we encourage you to listen to this podcast for health tips, it is not a substitute for a relationship with a primary care provider or clinic. Now let's get to today's episode. Hello, everyone, and welcome back. Welcome back to the Totally Woman Podcast. I am your host, Rosemarie Crosdale. It is indeed a pleasure to have you join me on this episode. This is episode 7. My gosh, episode 7. Time is definitely moving along. It's season 3, and we are on episode 7. My God, so much has happened since the last episode aired. Before we, get into the meat and potatoes of this episode, I just want to extend, as many of you know, that on October 28th, Hurricane Melissa, just wreaked havoc on my homeland, which is Jamaica. It was a Category 5 hurricane, and a lot of the island, especially on the western part of the island, was severely damaged, by this hurricane. So I just wanted to send my love and strength to everyone in Jamaica who is being impacted by the hurricane. We're a very resilient people. But, even during this time, it's really hard. And my heart is just, some of the pictures that I see, it's just unbelievable, the impact and the devastation that, has just the damage. Words cannot even explain when you see how severely damaged different parts of the island, how they've suffered. And I just really want to also say thank you. There's so many people who have just took it upon themselves. Some of them are not even from Jamaica. They've taken it upon themselves to whether they're going there, they're giving donations. So many people have come in through my church, through many different organizations where they're donating. I just want to say in terms of donating, though, please just be careful and just make sure that if you are donating, that the places that you're donating to, whether it's a website or, you're donating physical goods and stuff that you're bringing, that they're actually vetted and that you're making sure that, the people who are impacted are really getting the help that they need. So I just want to say again, my heart is really with the people of Jamaica right now. My family, thank God, most of them, they're doing okay. Some of them got, issues with flooding, losing roofs and stuff like that. So we've been definitely trying to, support them in the best way that we can. So just continue to pray for Jamaica. And again, I just want to say a big shout out and a big thank you to especially the women of, Totally Women. Thank you so much for your prayers. Thank you so much for your thoughts. And it is really, really, really appreciated, especially during this time. I also want to thank you for, following me and for continuing to support me on this journey, with this podcast that's, just I started, and it's just been going very well. And I just want to thank everyone who has continued to rock with me. Thank you very much for supporting me. And, we keep moving on, and we're just continuing to move on with the grace of God. So today, November, it's Diabetes Awareness Month, as most of you know. And during this time, we just want to bring awareness, when it comes to dealing with diabetes, and not just diabetes alone, because diabetes can impact, women, not only women, just the population in general. as we get older, diabetes, and diabetes can lead to cardiovascular issues. There's so many things that can happen as a result of having diabetes. And, today, ladies, today, normally I'm usually here by myself, but every once in a while, I do get the opportunity to welcome someone, to have a guest with me. And today is one of those days when I actually have a guest with me who is here, and she is very knowledgeable when it comes to, dealing with diabetes and women's health as well. So, ladies, totally woman, today we are just really excited, and I'm very excited to welcome today Dr. Patrice Powell. So that is who is joining us today. We have Dr. Patrice Powell. She is a board certified adult gerontology primary care nurse practitioner. And she's also the founder of Outlier Health and Wellness, and it's located in Fresh Meadows in New York, that is in Queens, where she provides comprehensive primary care, women's health services, and chronic disease management with a focus on diabetes prevention and treatment in women. She has extensive experience caring for women at risk for diabetes, living with prediabetes, and managing complex cases of type 2 diabetes, especially in underserved communities. Dr. Powell's approach blends evidence based medicine with real life, culturally sensitive guidance that empowers women to take control of their health. She's also an active member of DNPs of New York, that is the Doctorate of Nurse Practitioners of Color, the American Association of Nurse Practitioners, and the Nurse Practitioner Association of New York State. So, Totally Woman, join me in giving a round of applause to our guest today, Dr. Patrice Powell. Welcome.
Hey.
Welcome.
Thank you.
Thank you me today.
Finally,
Oh
I'm
my
on.
God, this has been, yes, it's been in the making. And listen, can I just tell you, nothing is ever done before the time. So the time is here
I know.
and it's your time now. And, I am really, really happy. Just as another woman of color, just doing your thing. Kudos to you, thumbs up. I'm so proud of you. And I just want to take this opportunity to say, you're doing the thing, right? You're just doing your thing. So, welcome.
Thank you. Thank you so much for having me, Rosemarie. And I want to say I am so proud of you too. I mean, we met each other when I was a baby nurse. Remember, I was just out of nursing school when we met.
Fresh out of nursing school. Yes, you were fresh out of. I was too fresh, Patrice. You were very fresh.
I was very fresh.
Yes,
very fresh out of nursing school, and look how far we've come.
By the grace of God, look how far we've come. Yes, and you have accomplished so much during this time. And yes, this is really a blessing. And it's really good just to see how, you've segued yourself from a nurse being at the bedside. We started out, together. We were at the same hospital together. We were doing post-op care for patients with so many different issues, like different types of surgeries. And we used to take care of those patients. And, you went back and you did your master's, and then you worked as a urology.
I was across the street in nephrology and transplant.
Yes, and you started doing that, and then you went back and pursued your doctorate in nurse practitioner. So yes, and you're just doing and now you have your own practice, right?
Yes. And I wish you'd join me one day.
I'm coming. It's all in there. Oh my gosh, Patrice.
I had to put you on the spot.
I know you have to put me on blast. Yes.
Because you are awesome with the women's health. This is your passion. And like we were speaking about before, like this is a point in our career when we're actually doing something that we love. Like we're putting time and effort into the things that we have passion for. And like I've always had a passion for primary care. I mean, I was doing it at another office and I felt like I had so much restriction, like
Yes.
15 minutes or 20 minutes, 30 minutes you have with the patient. Like, and sometimes it takes longer than that to be with a patient.
Right.
So I'm so happy and excited that I have the opportunity to have my own practice and make my own rules. So yeah, but thank you so
Yes.
much for having me on today. We're talking about diabetes.
So before we get into the meat and potatoes of it, I just wanted you to first of all just tell us some information in terms of, diabetes, what it is, how are, how are the women diagnosed with diabetes, and how can they just get themselves treated and stuff like that. So let's just like talk about what is diabetes first of all, and just getting the diagnosis of diabetes. How does that come about?
Okay. Well, diabetes is a endocrine disease.
Mm-hmm.
It's a chronic medical condition where your body cannot properly regulate blood sugar. So this can happen in a couple of different ways. There's two different types of diabetes mellitus, and that's type 1 and type 2. And today I'm going to be leaning more towards type 2 because this is the most prevalent. This is the one that we tend to talk more about when it focuses on diet and a lot of the medications that's out here. A lot of the type 1 diabetics, which are insulin dependent diabetics, these are people who usually develop diabetes way younger in life. We call it juvenile diabetes because people usually get it in childhood. And these people tend to get managed with an endocrinologist very, very young on. When patients have insulin dependent diabetes, they tend to know a lot more about the disease process and how to treat their diabetes with insulin therapy. And type 2 diabetes, it tends to get a little bit more confused because people don't know what they're doing. If they should do low carb, if they should do some carbs, a little bit of carbs, if they should be on medication or whatnot. So type 2 diabetes is a different type of diabetes. This is when your body becomes more resistant to insulin and your pancreas can't keep up to it. A lot of times it's linked to weight, hormones, genetic stress, lifestyle, and it can be improved by a lot of different lifestyle changes. So today I'm hoping that we can discuss some of those things as well
Yes.
as the way that it affects women.
Yes, definitely. Definitely. So, yes, the focus is definitely on type 2 diabetes, like you said. So, in terms of getting the diagnosis to know that you are type 2 diabetes, how would they be diagnosed?
Okay, so usually when you get like your annual done and your provider is doing your annual labs, we usually do like a blood glucose level on patient. With the blood glucose level, we tend to check to see if a patient has a high fasting glucose level. And if it is high, we tend to follow up with something called a hemoglobin A1C. And with the
Yeah.
hemoglobin A1C, we're checking to see if the number is greater than 6.5. That's the magic number. If somebody has a hemoglobin A1C of 6.5 and they tend to have an elevated glucose level of 120 and higher, we can diagnose them as being a diabetic. Or if we have them have like two elevated blood glucose levels twice in a row, we can diagnose them as a diabetic.
So the hemoglobin A1C, as well as the blood sugar levels, depending on what those numbers are, is how we get diagnosed as being type 2 diabetic. Okay. And then once that diagnosis is met, some of the times we usually encourage patients to, make some lifestyle changes because we usually don't want to start putting people on medication right away. That's not usually what we are about. Can you just go into a few of the lifestyle changes that the woman can make before actually starting on any diabetes medication?
So lifestyle changes that people can make, obviously, is diet. That's a huge
Mm-hmm.
component. And that's something that people tend to have the hardest time to face because we tend to grow up eating certain diets and getting stuck in certain habits that make it very, very difficult and challenging for us to change because habits are very, very hard to break. So diet is a huge one that we tend to try to attack first. Activity. We also want people to be active. And that doesn't mean that you have to go to the gym 50,000 times a week. It just means that we want you to be a little bit more active, like walk around a little bit more, maybe take a 30-minute walk about 4 or 5 times a week. If you have a dog, maybe be the one to take your dog for the nighttime walk. Be active in the house. There's all kinds of YouTube videos and TikTok things and so much different things out here for us to try to become more active at home. Even if it's like just getting a hula hoop or something like that, where you can just do something, some kind of activity. Another thing is dealing with your stress.
Oh my, oh my, oh my. That is the biggie. That is the biggie right there. Yes.
Yes.
Managing stress.
Managing stress. Yes. Because when you have high stress levels, your cortisol levels are high as well. We tend to have higher levels of glucose in our bloodstreams. So we definitely want to try to get our stress under control. And we also want to get good sleep. Sleep is something that we need to do for any type of chronic illness or disease, or just trying to be healthy and maintain a healthy lifestyle. Sleep is important. You want to try to get 7 to 8 hours of sleep as an adult. It's hard sometimes. I know sometimes I find my challenges trying to get those 7 to 8 hours in, but doing that will definitely help. And we always try to encourage patients to lose a little bit of weight. Maybe like 5% of weight loss definitely helps significantly for patients when they're diabetic.
Okay. So those are some of the ways that we can definitely incorporate. I know sometimes it's, we say managing stress and, definitely with the sleep, because I definitely know that, there are times when sometimes you're just able to sometimes get probably like a 4 or 5 hours depending, because especially us as nurses and, just in general, some of us have two and three jobs that sometimes you can't even, but we have to definitely try to prioritize these things before we actually get placed on any medication. And these are some of the lifestyle changes that we can make. Thank you so much for sharing that with us. So, if you're not able now to definitely, incorporate some of these things or make these lifestyle changes, when it comes to medication now, what is the initial medication regimen that someone with type 2 diabetes would be placed on?
Well, the first line of medication for patients is usually metformin. I know a lot of people heard of metformin before. That is the first step that we usually take. It's not GLP-1s, everybody. Everybody is so interested in GLP-1s because you can lose weight and things like that. But no, the first step to managing diabetes would be the metformin. It's a very safe drug. There's a lot of studies that show that it works. It works. The only thing with metformin is that people tend to have a lot of GI upset and things like that. So a lot of people won't take it like they're supposed to. Maybe every other day, they might skip it. The worst thing ever is when you put somebody on a medication and then you tell them to come back in 3 months and they never even started it. We definitely want to prescribe medications and have people take them. So ladies out there, if somebody starts you on a medication and you're not going to take it, just let us know. They
don't let us know. They don't tell us.
Let us know. Don't wait 3 months for the follow-up blood work to tell us you never started the meds,
Or you took it, or they started it, and then like 2 days later, they stopped taking it. Yes.
Exactly. So metformin is the first line. There are some other medications that's out there. Another one will be the SGLT2 inhibitors. Okay, so that would be like your Jardiance or your Farxiga. Those are medications that actually will kind of like pull the sugar out of your blood and put it in the urine. That's the best way that I can explain it and the easiest way that I can explain it to my patients. So a lot of cardiologists are starting to use this because it tends to help patients protect their heart. A lot of nephrologists are also using these medications to help protect the kidneys. So you will see a lot of patients be on Jardiance even if they're not diabetic. Another
Correct.
medication, we have those GLP-1. That's like the semaglutide and the liraglutide. Tirzepatide is a little bit different because it has two components. It doesn't just have the GLP-1, but it also has the GLP-2, I believe. Um,
Hmm.
I forget the other component of the tirzepatide, but there is another component of it which makes it a little bit more potent than the semaglutide. So it's a little bit different. People have a little bit different side effects of the medication. And then obviously we have insulin. Well, I tend to use insulin as like the last resort, or if I test my patient and I find that they don't have much insulin to give. So we have to supplement them with insulin. Or if they have insulin resistance that's so bad that these oral medications and these injectables aren't helping them, then we have to give them insulin to help get their sugars down. Also,
Right.
insulin is also used in pregnancy.
So insulin is safe to use around that time. Okay. Once you get started on medications and, like you talked about the side effects with like even metformin and stuff like that. And there are ways sometimes to minimize some of the side effects. So, we also explain to patients when they are taking these medications, some ways that they can minimize the side effects in terms of, when they eat, not to probably eat on a full stomach or go eat and go lay down and different things like that, or maybe other medication that they could probably take as well to help to alleviate some of the side effects of those medication. Um, if the GI upset, when we talk about that, it's primarily the nausea, or some people will have like issues with diarrhea as well. Is that one of the metformin issues?
So people with metformin tend to complain more of like stomach pain. It can be a
Okay.
combination of
A
diarrhea
combination
or constipation.
or constipation,
So
correct.
I tend to tell patients to take it at nighttime.
And that tends to help. Okay. So and a lot of just like with any medication, just like you said, some of the issues that are faced, and not only just with diabetes but with hypertension medications and any medications at all, is just a matter of being compliant and staying on these medications, because these medication can help. And once you've not gone on insulin, because we talked about that as well, once you've not gone on insulin and you're on these oral medications, we can get you to the point where you can come off of these medications. Is that something that you can say safely agree with?
Yes, once patients get
Yes.
their blood sugars under control, I always love to take patients off medication. That's my favorite thing ever, to
Yes.
either
Yes.
decrease it or take them off the medications.
Yes. Yes. So we do encourage. The thing is, we try to explain to them not to get to the point where you have to get to be on insulin, because sometimes it's very hard to get you off of the insulin once you've started on it.
Yes, because insulin tends to increase your hunger.
Mm-hmm.
Um, People don't realize it, but when you have to start insulin therapy, when your insulin levels shoot up, it naturally makes you more hungry, because your body, the sugar levels are dropping. So now your body believes that it's time to eat again,
Mm-hmm. Mm-hmm.
which is why it's kind of like a really, really bad cycle sometimes when people have to end up on insulin. But we have to be vigilant and stick to our diets, and maybe add a GLP-1, which is something that can kind of block that hunger a little bit, because the GLP-1s can tend to create a feeling of feeling full when you're taking that medication. So a lot of times, I would start a patient on a GLP-1 before I start them on insulin therapy. And I think that seems to
Understood.
help a
Mm-hmm.
lot. And a lot of times, GLP-1s could be just as potent as insulin therapy if a patient has very, very high blood sugar.
So the GLP-1s are very effective as well. And they also aid in weight loss. So we find a lot of times now that, those are the medication of choice to put women on, because this will help and aid in weight loss as well. as long as they're eating properly. And also not just, even though you're on a GLP-1, you still have to make sure that you're eating properly and you're moving your body. Just like you said, you still have to exercise and, get enough sleep and, rest and all of that, minimize your stress for these medications to work effectively.
Yes, absolutely.
Sometimes, just diabetes alone, just having diabetes, there's so many other issues that can come up as a result of being a diabetic. And these are some of the things, like you said, just protecting your kidneys. A lot of times we have people who they're diabetic and then they end up having issues with end stage like renal disease. They become, they start having issues with their kidneys, and now they're in a situation where they have to end up on dialysis and stuff like that. And this is one of the reasons why we want to try to get the diabetes under control before it gets to this level. And it can also, segue into having issues with hypertension and issues with cardiovascular issues as well.
Absolutely. I mean, diabetes affects almost every part of the body, like literally from the rooted to the tooted, right? So cardiovascular disease, and diabetic women tend to have a higher risk of heart disease when they're diabetic, urinary tract infections, yeast infections,
yes.
Sexual dysfunction, osteoporosis, especially when you're postmenopausal. Mental health, people tend to get very depressed. They have a lot of anxiety because of this. You can have skin changes, fungal males, periodontal disease. I mean, I have patients, their diabetes gets so bad that their teeth are literally falling out of their mouths. Hair changes because the hormone imbalances, neuropathy pains, and it list goes on and on and on. Retinal problems, people end up with glaucoma, cataracts. I mean, hunger, we spoke about. We also have gastroparesis, and that's an issue where like your gut kind of slows down so much, and it can cause a lot of constipation, a lot of bloating, a lot of pain. A lot of patients have that kind of issue when they've had long-term diabetes. Some of these are issues after having diabetes for many, many years, but depending on how uncontrolled your diabetes is, some of these things can pop up a little sooner than you think.
Yes. It's amazing. And, like you said, uncontrolled diabetes, my God, I mean, the list just keeps growing in terms of, some of the other issues that you can face. And we want to especially encourage the women to get their eyes checked. Very, very important. You have to have your eyes checked, following up with your primary doctor, coming to see you, like, because this is what you do. You come in to see a nurse practitioner, you see your primary doctor, who sometimes now you may have to refer them also to an endocrinologist because they may need more additional workup. And issues and things like that. But definitely you have to follow up with your eye doctor. Eyes are very important. You talk about the retinal issues, cataracts and glaucoma. You talk about neuropathy. And when we talk about neuropathy, for those of you who may not be aware of the term, sometimes neuropathy is a thing where you have decreased sensation in your extremities. And this is why sometimes we have people with type 2 diabetes who may end up getting an amputation because now their sensation to their fingers or sensation to their feet, they've lost that sensation. They don't even realize. You talk about the periodontal issues, getting your dental checkup. A lot of times we don't realize how important mouth care and oral care is. In dealing with some of these issues as well. You talk about the yeast and, different kind of issues that can happen as a result of just having type 2 diabetes. And this is information that, we want the women to be aware of, that they're actually getting their screening. Dr. Patrice, can you just talk about how important it is? Because I have actually, gone into screenings and wellness and stuff like that. Can you just explain to the woman, just in a just your little take on just getting screened? Because we want to, and what screening does is that we're screening you before you actually get the disease, and the importance of screening. Can you just tell them something that will just prompt them to go, that if they haven't been screened as yet, they would want to go and get screened?
Oh my gosh. I have, you know, because I've seen so many patients and so many of the worst ways because of diabetes, especially because I see patients at home as well as in the clinic. And my patients that are at home, I have so many patients with missing, first they miss the toe. Then they have to go back and get half of their foot chopped off. Then they have to go back and get the entire foot taken off. Then they start working on the other foot. Sometimes they start working on fingers. In addition to that, they get vascular disease, where they get a lot of plaque, they say, in the arteries, in the legs, where they have very, very poor circulation. And sometimes it gets so bad that you can't even really put stents and things like that in there to help with the circulation. So people tend to get a lot of amputation. And it's not like just one and done. It's not like you find out and then all of a sudden, you know, we're chopping off a leg. We find out way longer than that. We find out early. We want to find out early. And we tend to find out early if you're going to the doctor. I mean, when you're going and you're getting your blood test done, we usually always do a comprehensive blood screening. And with that comprehensive blood screening, that usually has a glucose level, a potassium, a sodium. We are checking your kidney function there. We're checking your liver. This is a very basic test that tells us if your blood sugar is high. And if it's high, it's a flag. That is a very, very quick screening right there. If it's high, then that's our way of telling you, hey, there's something here that might be going on. Maybe we need to make a little bit of tweaks to your diet so that we can get this number down a little bit. I think that we can work on this without starting you on medication. But if you tend to forget about it and you just leave it in the back of your mind and you don't do anything about it, then 6 months later, you can turn into a full-blown diabetic. And when I mean full-blown, I mean high numbers, A1Cs of 10. I've seen people be pre-diabetic one visit, and the next visit, they're like super duper high. I'm putting them on 2 different medications, all in the first visit. Like sometimes it can be like that. So ladies, please get out there and get screened. All we want is a little bit of blood, just a little bit. Only 1 tube, that'll be fine. We can even do it with a finger stick in the office if you let us.
Yes, yes. I mean, we cannot preach enough. We cannot say it enough how important, screening is. And I just want to implore the ladies, this is not a scare tactic. This is not to scare you, but sometimes we do have to scare you a little bit just to get you to do what you need to do. And ladies, this is very important. Nobody want to be walking around with, no fingers and you having amputations and stuff like that. Or now because you cannot see out of maybe one eye, or you have no sensation in your extremities or cardiovascular issues. And these are just some of the things that can happen as a result of having diabetes that is not controlled. And like you said, we're talking about type 2 diabetes. So I know this has been a lot of information. I really, really, really just want to thank you, Dr. Patrice, for just like going in and really just breaking it down for the ladies, just to let them know, what it is that they can do. Just like you said, you talk about, starting them first, even before we start on medications, just making some lifestyle changes. Medication is usually not the first thing that we want to do. No, if you go to a doctor, and like you said, it may have to be because it could be one visit where you said that someone is pre-diabetic, and by the second visit, they're coming in and now they have A1C levels of 10 or greater. So like someone like that, you would have to start them on like insulin or something like that right away. But if you are actually, taking screening seriously and getting your exams done and stuff like that, we can really, you know, spot you early where we can get these treatments started much sooner rather than later. And that's why it's very important to screen.
Seriously, ladies. I mean, having diabetes can cause us so many different issues as women. I mean, vaginal dryness, painful intercourse, yeast infections. I've seen some of the worst yeast infections because of the diabetes. Like almost like terrible diaper rash all the way up from the front all the way to the back. Primary prevention will definitely be to try to lose weight. If you know that you're overweight and you know that your blood sugars tend to be running a little bit high, even if you lose 10 pounds, it'll make a big difference. You want to definitely try to cut back on processed foods, especially things like processed cheese, processed cereals. People think that cereal is so healthy. It is not healthy. These cereals in the box with fortified iron and things like that, these things are not healthy and they have a lot of hidden sugars in them. You want to focus on non-starchy vegetables, lean proteins, healthy fats, and just really be vigilant on having a lower carb diet. You want to try to do less than 130 grams of carbs per day so that you can kind of be on like a low carb diet. Okay. If you are diabetic, you want to try to have a tight control on your diabetes. You want to make sure that you're testing your blood sugar, at least the fasting sugar in the morning, so that we know what your baseline sugars are. I know a lot of people complain about sticking themselves several times a day, but the fasting one is the most important one. And I do like to get one before you go to bed if you can. But morning time, blood sugars, very important. Make sure you get your feet checked, your skin checked, get your oral hygiene. Make sure you're getting your eye doctor appointments. If you're having mental stress, get help. Get help. Please, ladies, talk to somebody.
Yes.
There's support groups, there's people, there's friends, there's church. There's so many different ways to kind of release some of the stress. And if you're alone and you don't want to deal with people, start meditating. Do guided meditation. There's all kinds of things that's on YouTube that you can listen to and do guided meditation so that you can help relax and get some of the stress off, because stress is a killer.
I want to thank you so much, Dr. Patrice Powell, for joining me today. Thank you for the knowledge that you have imparted to the women on my Totally Woman podcast. It is really, 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 really appreciated. I really want the woman just to take stock. If you have not yet been screened for diabetes, I really want you to try and make an appointment with your primary care provider, with your nurse practitioner, just to make this a priority to get to at least know your status, to know where you stand. Get the blood work done. Like she said, a comprehensive blood panel, a BMP, basic metabolic profile, knowing your hemoglobin A1C. It's a simple blood test, even just checking your blood sugar. These are ways that we can start to screen you, because we won't be able to treat you if we don't know your status. So knowing your status is a way for us to get the proper treatment started, just making simple little changes, lifestyle, losing 5 or 10 pounds. Like she said, you don't have to go and, join and go crazy in the gym. You could just simple walking, just simple, going out to walk 10, 20 minutes, 30 minutes, depending on the time that you have, that you can just dedicate. And these are things that will help to lower your blood sugar, minimizing stress and getting sleep. I know sometimes it's easier said than done, but these are things that we have to incorporate into our lives to make sure that we're staying healthy. Staying healthy is the goal. And as we're nearing to the end of the year, tomorrow is not promised to any one of us. We can see in the twinkle of an eye how things can just go from 0 to 10 to 100 in no time.
Absolutely.
So we just have to just stay positive. And I just want to encourage everyone. I'm here to support you. Dr. Patrice is here to support you. I will also link her information for those of you who are in Queens. If you're in the Fresh Meadows area, if you don't have a primary provider, she's taking new patients. You're still seeing new patients, right,
Yes,
Dr. Patrice?
I'm seeing new
Yes,
patients. I do accept insurance. You can see me at outlierhealthandwellness.com.
Okay, and we'll link her information in our bio as well. And we'll also put a link where you can donate to the hurricane relief, whether you're donating non-perishables or whatever you can, donate. We'll also link a link that you can make sure that the website that you're donating to is very credible. So again, Dr. Patrice, thank you so much for joining us. I know you, as of now, this was your first time and you won't be a stranger. Next time we'll definitely have you on again. Thank you for the knowledge that you have imparted. And I just hope that the woman will just take this seriously and just get your, know your numbers, know your status. That's the most important thing. And like I always say, let us continue to motivate, uplift, and just inspire each other. Thank you again, and join me on the next episode. See you soon. Totally Women Podcast is hosted by Rosemarie Crosdale and powered by Indie Creative Podcasts.